Hey friends, welcome back to Thrive and Align Healing Podcast. This is episode 41, and this week we have a special guest. We have Miss Amanda Rook. She's one of my good friends, but she is also an amazing pelvic floor physical therapist, and she's the owner of Pelvic Care Physical Therapy. And today she's just gonna enlighten us in this world, this very magical world that's been pretty life-changing for me. So I think it's a world that a lot more women need to be aware of. Welcome, Amanda.
Thank you, Kim. So I am Amanda Rook, and like Kim said, I am a physical therapist. I specialize in pelvic floor physical therapy. So that's basically physical therapy that's treating bowel, bladder, and sexual dysfunction. So the pelvic floor is a set of muscles that goes from your pubic bone in the front to your tailbone in the back. And these muscles, like Kim said, are pretty darn magical. They do a lot of functions, but they help with continence. They help you to not pee and poop when you don't want to pee and poop. And then, yes, pee and poop when you do want to pee and poop. They help you have an awesome sex life. They help your blood circulate through that area of your body. They help support all of your pelvic organs and hold up your rectum and your bladder, and if you're a lady, your uterus. So I'm sure I left out a couple functions there, but they are pretty magical. And specifically, I wanted to talk today about just shattering misconceptions about pelvic health, because I think that, so basically myth busting. I think that a lot of people assume if they think about the pelvic floor or pelvic floor physical therapy at all, they assume that's for pregnant ladies. That's for, and so it's a small subsection of the population that they think that this stuff is relevant for. And it is very helpful to have some really great pelvic floor physical therapy in the pregnancy, when you're pregnant or in the postpartum period. Or people assume well, probably only old ladies need that. And also a myth. So pelvic floor physical therapy is great for, women over the age of 65, because there are some really, after menopause, there are some age-related changes that happen in the pelvic floor area, mainly associated with estrogen reduction, that pelvic floor physical therapy can really help with. But again, this is just one of the many populations of people that that pelvic floor physical therapy can really help. So that's my overview. So yeah, I especially wanted to touch on three main myths. So the idea that pelvic floor PT is just for women who've had kids. The idea that men don't have pelvic floor issues, that's a myth. And the idea that Kegels are the answer for every pelvic floor problem. So, and there's other ones we can talk about too, if you guys want to discuss more. Kim and Carmen, is there one of those that you guys especially want to start with, or I can pick?
Well, real quick, I was hoping maybe you could tell us a little bit about sort of your average client. Who are the types of folks that you serve?
For sure, Carmen.
Yeah, and that'll help us maybe lead into a little bit. Yeah.
Yeah. So I own Pelvic Care Physical Therapy, and I'm sort of what you would call a boutique practice. So that's a fancy way of saying I'm a very tiny little medical practice, or physical therapy practice. So I have designed my physical therapy practice to serve clients one-on-one. And so I try to let each client have an hour with the doctor of physical therapy, who is me. And so that structure lends itself really well, I think, to working with clients who need kind of want an extra degree of privacy. So I'm especially aiming to serve people who maybe have had trauma, or just would I guess, really focused one-on-one attention. So I really Most of my clients, I think, it's not like I have a specific niche of like a specific condition that I treat. But I guess I could say recently I've been working a lot with bowel issues, especially constipation. I'm getting pretty excited about all of that knowledge. So I like to treat colorectal issues. I also like to treat fitness athletes that are having pelvic floor conditions, whether they be like prolapse or incontinence. I started doing CrossFit in the past 6 months because I was like, I identified as a yoga person and I wanted to learn more about plyometrics and weightlifting and stuff so that I could help my clients more and really understand like what those movements entailed. So anyways, fitness athletes, colorectal issues, and yeah, I treat a lot of incontinence. I do treat like pregnancy and postpartum. Yeah, so.
Perfect. What about, so you mentioned Kegels, and that isn't the only one. I think a lot of us have heard of Kegels and maybe whether they're familiar with it or not, especially as women, but how about you tell us a little bit more about that?
Yeah, so Kegels are basically, it's another word for pelvic floor contraction. They got named that way because I think his name was Alfred Kegel or Adolf Kegel or something. Anyways, he was just the first one that started talking about doing pelvic floor contractions. But basically a Kegel is one cue that we use is to imagine that you are peeing and you're trying to stop the flow of urine. Or that you are in a crowded elevator and you feel like you need to fart and you try to stop it. So, of course, when I think about Kegels, I'm like, well, those two cues were actually for really different muscle contractions. One was for a squeeze around the urethra, one was for a squeeze around the anus. So there's lots of different ways to do Kegels. You can squeeze around your urethra if you have a vagina, your vagina. And your anus separately. You also can squeeze the superficial pelvic floor muscles separate from the deep pelvic floor muscles. And it's really important to know not just how to squeeze, but also how to relax. And so I think that's the underserved component of a Kegel or pelvic floor contraction is people think, oh, I need to strengthen my pelvic floor. That'll solve all my problems. And for many people, that is what they need. But for a larger population of people, they need a combination or perhaps a sequence of first focusing on down training or relaxing the pelvic floor and then strengthening. Or maybe they just need a lot of that down training and relaxation because maybe they have pelvic pain or constipation or difficulty emptying their bladder. So yeah, Kegels are awesome and magical, but definitely nuanced and complicated. And a lot of people, when they're doing Kegels, they think they're doing a Kegel, but actually they're doing something really different. They might be like pooching, they might be like blowing their stomach out, like pooching their stomach out and sort of doing what we would call a Valsalva, which is actually can be really not great for the pelvic floor and the pelvic organs. Or they might think that they're squeezing and actually be like squeezing their thighs together or squeezing their butt, but they're not actually squeezing their pelvic floor. So
there's a myth out there, I think, because this isn't talked about a lot. So there's like the education around it is pretty minimal in my experience. And so there's this idea that if you, for women, I think in two groups, like you've either had a baby, so you're going to suffer from this stuff, like incontinence and stuff, or the other part is there's something like wrong with your vagina or you're too loose if you haven't had a baby, and that's why you suffer from incontinence. And so then the idea is like, oh, well, I'm too quote unquote loose. I just need to do Kegels to fix all this. And I think that that's what a lot of people believe.
Yeah. And I think that concept of having like a loose vagina is very damaging and like, part of our sort of messed up patriarchal culture. Sorry if I'm using the word patriarchal is, I don't know if that's acceptable or not, but it's part of our cultural sort of narrative that's going on, that you have to have a quote unquote tight vagina to have a well-functioning vagina. And that's just really, the whole conception is false, because I always tell people, first of all, your vaginal canal is, when we look at anatomy diagrams, they always show it like this tube, like a cylinder, like a toilet paper roll, just going straight up. But actually, the vaginal walls are very adaptive. Like they can squeeze in and they can expand out. So really, the vagina is kind of more like a pocket, or it's kind of like a wine glass inside. So like when I am doing internal myofascial release, or doing like some, the fancy word I use is like digital biofeedback. But basically when I'm inserting my finger vaginally, to be able to tell what someone is doing with their pelvic floor muscles, I'm not inserting a finger straight in. That would be the tube or the cylinder model. I actually insert and go to the side, because the vagina is more like a wine glass, it has rounded sides to it, and they are expansive. So yeah, this concept of having a loose vagina is, it just doesn't make any sense. Now people can have changes to their internal anatomy, like to their structure, that can happen. Like, let's say if they haven't had kids, if they've been straining a lot when they have bowel movements, or if they've had a lot of pelvic or abdominal surgeries, or if they've had radiation for cancer, or if they have had children's, the process of pregnancy and childbirth, all of those things can cause changes that can cause the organs to shift. They can sort of stretch the ligaments that are supporting the organs, and they can sort of change the resting structure of the vaginal walls, so that there's maybe a little bit less stiffness at rest. But the thing is that the pelvic floor encircles the vagina and the urethra and the rectum. And the pelvic floor musculature is sort of the part of the puzzle that we have the most conscious control of. So if somebody is having issues with, maybe like prolapses, where your ligaments maybe have lost some of their tensile integrity, like they just, the ligaments aren't really tacking the organ in place as well anymore. But we can't really affect the ligaments with our conscious control, but we can affect the muscles, and we can strengthen them. And so we can actually support the organs, from the bottom up, and sort of help the vaginal walls become stiffer through that muscle bulk. Or if you've had a lot of surgery, people think about being too loose, but actually for an equal number of people, the issue is being too tight, would be like a colloquial way to say it. So if you've had radiation, or you've had a ton of surgery resulting in a lot of scar tissue, or maybe you just hold tension in your body. A lot of the people that I see, they identify as, like myself, like perfectionistic and like a little bit type A, and that those personality traits kind of lend themselves to a lot of motor activation in the body just all the time. Like I always tell people, if you tend to tense your shoulders or squeeze your butt when you're stressed out, you may be squeezing your pelvic floor too, and that can create too much tension. And so we also have conscious control over our ability to relax the pelvic floor muscles, and sort of expand the vaginal wall or the rectal wall or whatever it is, that's maybe too tense and causing problems. And then manual therapy can help with all that too. So
yeah, I mean, it's super interesting, and I'm glad that you're talking about it, right? Like I'll I guess, disclose that Amanda's my pelvic floor physical therapist. And like that was like, I was constantly pushing down on my pelvic floor, just constantly, because I am type A, right? And it's like, growing up, mom would never, like, she always like was like, never sit on a toilet that's not yours, like hover. So ever since I was a kid, like I hovered, and it's like, hurry up. So you hurry up and you push as hard as you can so you can piss as fast as you can, right? And so just getting into that motor pattern of constantly pushing down, constantly like in weightlifting or in CrossFit, constantly pushing down on that pelvic floor, which was always causing, like, for double unders. So all my CrossFitters out there will know, like, double unders and sometimes box jumps for women. It's just constantly like not able to control my bladder. And it was really helpful when I started going to Amanda, and she was like, wait, we got to learn how to like relax.
Yeah, which is really hard, like easier said than done if you are, type A. It takes practice. It takes practice to relax. And sometimes with a lot of my clients, like the first session, I give them belly breathing, and then like applied belly breathing, like they do it as an exercise. And then and belly breathing is like diaphragm breathing. It's a way to use your breath with a deep inhale to apply some pressure to your pelvic floor and get a little bit of stretch and relaxation in your pelvic floor. But I'll apply it as an exercise, and then I'll also ask them to apply it to their toileting habits, or maybe their lifting habits and fitness habits. And I'll be like, this seems like I'm not giving you anything. And you may like pass it off and be like, whatever, this lady's crazy. I went to her for physical therapy and she gave me some weird breathing exercises. But this is going to be the hardest exercise you ever do in your life if you are, if you've been practicing your whole life, holding your body tense and pushing to get things out, or whatever, the patterns may be for that person. So yeah, a lot of it is, in the technical jargon, we call it like motor patterns or motor control, but it really is like how you live your life, like how you hold your body. And there is definitely so much that comes from childhood. Like a lot of it is how our parents taught us how to pee and poop, really affects the rest of our lives, and so pediatric physical therapy, that's another kind of myth about the pelvic floor, is that like, well, definitely that stuff wouldn't apply to kids. But actually there are people that do pelvic floor physical therapy that work with children. They don't do any internal work. So that's really important to say, because I think that's a thing that needs to be really clear. But yeah, a lot of kids that have like constipation or difficulty urinating, or even pelvic pain in some cases, they can be well served by having some pelvic floor physical therapy. And man, I don't do that. I would love to learn about that someday. That's like super, super advanced skill set in my mind, because you have to like somehow talk about peeing and pooping and have it be play oriented, and have it have like amazing boundaries, because you're working with a beautiful, precious child and want to teach them how to like, know boundaries about their body. So anyways, but there are amazing professionals that do that work. And yeah, and I think that's really important, because a lot of people that have, let's say as an example, like constipation in childhood, if those issues aren't addressed then they may last, for their whole lives. And then they may end up straining with bowel movements for their whole lives. And then they may end up having other issues like prolapse that results because of that. So,
yeah. I'm excited that we're talking about this today and like sharing people another perspective, because I see this often where people who have either had constipation their whole lives, right? Their mom had constipation, their sisters were constipated, their whole household was. And so now they're, as an adult, this is just part of their norm, right? And they don't realize that isn't great for our body, right? Or even constant diarrhea. I see both sides of that. And I think that, part of that is that we don't often talk about those functions in the world. And so people know what they've learned when they were kids, right? During potty training, during those, intimate understandings of their body as they were growing up, even through their teenage years. And, if it's what they've seen in their family and they're like, oh, well, this is just normal. Or they're, I've also seen where folks have been to a ton of different specialists, right? They've had diarrhea for 15, 20 years, and they've been to tons of specialists and nobody can tell them what the problem is. And so they don't know that they have the opportunity to work on that bowl of muscles to be able to support the elimination process, so that they don't have to continue to be in that pattern. Right. I mean, we always work it under the underlying root cause and addressing the microbiome and all of that. But oftentimes it's also that those mental and emotional cues that have been associated with that understanding of how they eliminate their bowels and their urine. And so, yeah,
Yes.
thank you for sharing your perspective too, because it's a little bit deeper, and giving people some sort of options and some hands-on opportunity to understand, right, how they can control and sort of use and build those muscles on a conscious level, versus just like, okay, this is part of my body, I guess, I don't have control over that. And so,
Yeah, Dr. Carmen, I love your perspective too. I mean, I second everything you were saying, like that. For so many people, because it's always been the norm for them, or because it's kind of part of their family norm, and what they were taught was just normal. They think, well, there's nothing I can do about it. It's peeing and pooping. Like, people assume that is a part of our life and sexual function. Like, say if somebody has pain with sex, they're like, well, that's just an involuntary function of my body. That's nothing I can do about, like, only, maybe surgery or medicine, drugs can help with that. But so that's something. Or I talk to a lot of women that are like, well, I've had 3 kids, so of course I have this, so they're just like, whatever. And I'm like, well, it's great that you, like, I'm all about just like loving your body where it's at, but also, like, do know if you ever did want to do something about it, like, it would be very worth trying, if you decided that you wanted to try to change it. But then also, let's see, what else were you saying? Anyways, I just love everything you were saying. Oh, about like the biome. I love, definitely a lot of, I remember what I was going to say. Yeah. So definitely like working on getting the gut biome to be optimal is huge. And Dr. Carmen, you probably, know a lot about that I would love to learn from you. But also I think when people have seen just a million specialists, and it can get saddening as a pelvic floor PT to see so many people who have been through so much in the medical system. And it's not like they're going to see people that aren't at the top of their game or aren't doing a good job. Like, all the people they've seen have really tried to apply whatever tools they have in their fields, to help. But yeah, the neuromuscular and like musculoskeletal components are just a part, I think, again, because of our culture, our Western culture, focusing on surgery and drugs and really not focusing on, mindfulness and the mind-body connection, and the physical, like, muscular body. We just kind of historically have left the kind of the physical therapy side of things out, and the like alternative or complementary medicine side of things out. And those are so relevant when we're talking about bowel, bladder, and sexual function, because they are this, again, magical, really fascinating, but sometimes really frustrating parts of our body that have a lot of involuntary components mixed in with the voluntary components. So there are parts that seem out of our control that are controlled by our autonomic nervous system. So that means they just happen automatically. But for some people, they stop happening automatically, like all the reflexes involved in having an easy, carefree pee or poop, or sorry to like mention it all in one sentence, but like, or like have sex in a carefree, happy way. When those things don't just happen easily without thinking about it, there are ways that we can intervene in the system, even with, if you think about like the autonomic nervous system and sort of being on high alert for somebody that's had chronic pain, or maybe that has a lot of depression or anxiety or other kind of like psychosocial things going on that create a lot of tension in their body and maybe create constipation or pain or difficulty emptying the bladder. We can use the breath to control, to impact the autonomic nervous system. We can use meditation. We can use like fitness, we can use the diet. We can use all sorts of inputs can help us make changes with the involuntary processes of our body. So
well said, Amanda.
Yes.
oh, thanks.
Yeah.
So I think you just kind of touched on that, but I was going to ask if you have some sort of overall general advice for folks on ways to either support their pelvic floor or start paying attention to their pelvic floor. That you could share with us.
Yes, that's such a great question, Dr. Carmen. I love that's a great question. General advice. Okay. So the first thing I would say would just be, if you do notice issues with leaking pee or poop, having some incontinence, not being able to pee and poop when you want to, or if you have any pain in your belly, and even back or hips, or in your pelvic area, in your genital area, just know that those things are like medical issues, and sometimes it seems hard to talk to somebody, it's hard to go to your doctor and be like, hey doctor, I can't have sex right now because I don't know why, but it really hurts really bad when I try to have sex, or I haven't had a bowel movement in 5 days and I'm really freaked out. It's really hard to go to somebody and talk to them about it. But just know that those things are common, but they're not technically medically normal, and that there are things you can do about it. So that's the first thing I would say, is go seek medical help, and know also, not to toot like the physical therapy horn too much, but we have direct access for physical therapy in the state of Oklahoma now. So you actually don't need a referral from your doctor to go to a PT. You will, if your care exceeds 30 days, you'll need your PT to be talking to your doctor or people on your medical team. But so go get help, either from your primary care provider or a specialist or a physical therapist. And then the second thing I would say is just, I think it's really important to understand that the pelvic floor, which again is the muscles you squeeze when you're trying to stop urine or stop a fart, those muscles are muscles like any other muscles. So I always tell people, just like when you're doing a bicep curl, you wouldn't do a bicep curl only half of the range of motion. You wouldn't do like a tiny little bicep curl with your elbow totally bent. You would go all the way down and totally straighten your elbow. So you would totally elongate the muscle and relax it. And then you would totally squeeze it all the way to the top. And we need to do that with our pelvic floor too. So if you're able to take a deep breath that fills your belly with air, and then exhale and squeeze and lift your pelvic floor like you're trying to stop the flow of urine, and then inhale and totally relax as you take a deep breath in, then that's great. Then you're probably already like really advanced in terms of pelvic floor skill. But if you try to do that, inhale, relax the pelvic floor, exhale, squeeze it, and you're like, I don't know if I'm squeezing, or I'm kind of trying to squeeze, but it feels super duper weak, or like all I feel is like my butt squeezing or my inner thighs squeezing. Or if you feel like you squeezed and it hurt, or if you feel like you squeezed and you couldn't let go afterwards, those would be those are reason enough to go seek help, even if you're not having like medical, even if you're not having incontinence yet, even if you're not having constipation yet, or pain with sex or whatever. If you feel discoordinated in that area, I think it's worth having a wellness visit, with the pelvic floor PT. And that's part of what I'm really excited about getting to do with my practice set up the way it is just like having a session with someone once, and just being like, hey, let's troubleshoot some issues with your bowel movements. Let's check out your motor patterns with your pelvic floor, your coordination, practice some really good habits together in session in terms of being able to like have a good activation and relaxation of your pelvic floor, apply it to your bowel movements if that's your concern, and then you're at the door and you're just better, you have the knowledge, so just so wellness visits are great. So that's what I would say.
Perfect. I love that. So I'm definitely from the perspective that prevention is always usually easier than trying to go after the fact.
Exactly.
And so as women, we always, because we hear about it a lot, I think a lot of women have that concern of prolapse, or, if they're starting to experience incontinence. So to know that there's something available and something they can do that doesn't include surgery, I think is an awesome resource for folks. So I'm very excited.
Yeah. And it's like surgery is really useful and helpful for some people. But there's a spectrum, or there's kind of like a continuity where it's like if you use prolapse as an example. So prolapse again is if one of your pelvic organs has shifted, the ligaments have become a little bit lax and it's out of place. So for women, it could be like your bladder coming into your vagina, and it's a hernia, basically. It's like a vaginal hernia. Or for men, you can have rectal prolapse, or anybody could have some like perineal descent. So that area in between your urethra and your anus, kind of sticking lower than you'd like. But anyways, with prolapse, for lower grades of prolapse, if there's less herniation, pelvic floor PT and other interventions are the first line of defense, and often a prolapse will correct itself on its own. It's kind of like a disc, a disc herniation. If you have like lumbar or low back problems, and you have a blown disc or whatever they say, or herniated disc, often getting stronger, getting some really great motor patterns, and just maybe developing really great alignment, going to chiropractic, going to PT, getting some better nutrition, all those things, it can actually correct itself, on its own. And even if it maybe doesn't anatomically perfectly correct itself when you look at it in, an MRI, CT scan, X-ray, whatever, you don't have functional problems anymore. So it's kind of a moot point, So yeah, surgery is really necessary for some people, but there's so many other options and opportunities for intervention where you maybe won't need to have surgery. And so, yeah, it's really good for people to, I think as a culture still, we're really expanding our mindset about medicine and health, and have been for decades. But I feel like it's becoming more mainstream to think about complementary and alternative medicine and physical therapy and chiropractic and naturopathic medicine and the mental health side of things as health, And I'm really glad for that, because I think it helps us, be healthier.
Yeah, for sure. So Amanda, if people want to work with you, how do they reach you?
Yeah, thanks for asking, Kim. So I have a website, which is pelvic care, www.pelviccare.org. I'm on Instagram at pelvic care, and I'm on Facebook as pelvic care PT, or you can look up pelvic care physical therapy. So I'm based in Norman, Oklahoma. And you're always welcome to call or email or text me. I mean, my business line goes straight to my cell phone. So I always try to get back to people within a day. But yeah, calling or texting is great. My number is 405-240-9575. So
yeah, and I'll link all that up in the notes so people will have that.
Thank you. Yeah, and I'm a cash-based practitioner, so that I can spend that really focused one-on-one time with people, but also I love to be a resource to connect people with quality pelvic floor physical therapy throughout the state. So I'm a part of a Oklahoma Pelvic Health Alliance, which is kind of like a professional network for pelvic floor physical therapists in the state of Oklahoma. And so if people do come to me and it's really important or necessary for them to use their insurance for their physical therapy, I can help connect them to another provider that I know will give them good care. So,
Nice.
yeah.
Awesome. Well, thank you so much.
Thank you guys. It was super fun talking with you.
All right. Anything else, ladies?
I think, yeah, thanks for joining us. It was very informative. Yeah.
Awesome. Thanks for all your questions. Yeah. I was prepared to just motor mouth, just go for it. So I was like, oh, thank you, Kim and Carmen, thanks for asking questions.
All right, friends. We'll see you guys next week.